I would think that you would need somewhere between 70, 75, maybe 80% of the population vaccinated. If we get that, we would develop an umbrella of immunity that would be able to protect even the vulnerables who have not been vaccinated or those in which the vaccine has not been effective. You can get that kind of immunity with that percentage of people.
Dr. Fauci there, and how much of the American population needs immunity to the coronavirus for life to return to normal. For more, let's bring in Surgeon General Dr. Jerome Adams. And Dr. Adams, I want to ask you, among other public health officials, have been urging people to stay home for the holidays, to forego large family gatherings. But we've seen a lot of people traveling. The TSA says that 7 million people were screened in the week leading up to Christmas. Are you concerned that we're going to see yet another post-holiday surge?
Well, we're very concerned, and we always see a little bit of a bump after holidays and sometimes a large bump. But what the important thing for people to understand is that even if you traveled, it doesn't mean you just throw your hands up in the air and say, oh, well. There are measures that you can take, and the CDC, I'd like to remind people, recommends that 3 to 5 days after travel or after you've been around people without a mask on, you go out and get tested. And getting that test now means that if you were exposed to asymptomatic spread from someone else, we can find out and we can limit your ability to spread to others. And you should definitely stay away from vulnerable people, your grandmother, your aunt, over the next 14 days or so if you traveled, so you don't give them coronavirus from your holiday gathering.
The CDC is now requiring a negative test for any travelers coming from the UK. But officials had been downplaying the threat of these new strains that we are seeing, these variations in the UK. I think you had said earlier this week that a mutation doesn't mean the virus is more dangerous or more deadly. And Dr. Fauci said that these variations may already be here in the United States. So why this new step? Why this new restriction?
Well, important for people to know that we're layering protection on top of protection on top of protection. No individual protection is going to be 100%. A lot of Americans don't know that back in March, through the presidential 212F authority, we restricted the ability of people to come to the United States from the UK, and travel is down 90%, even pre-knowledge about this new variant from the UK. So we've already had severe travel restrictions from the UK. Testing within 72 hours isn't 100%. It's not perfect, but it does further decrease the number of people who will come in. And then what we recommend to people, according to the CDC, is that once you get here, you still isolate for 7 days if you've had a negative test, or for further longer than that if you don't get a test on this, and 10 to 14 days. So those things layered together will significantly decrease our chance of exposure to a new variant. But here's what the American people most need to know. Mitigation works. The science shows that it works. So if you're worried about a new, potentially more contagious variant, it is that much more important that we follow the 4 W's. Wear a mask, wash your hands, watch your distance. And the fourth one is wait on gatherings, especially with one last holiday coming up, New Year's. We need to be very careful.
You said that you understand the skepticism from many African Americans about the vaccine, obviously, given the history of medical racism in this country. And you, of course, got vaccinated on camera to send a message. What else needs to be done to convince people, including some of those most vulnerable, that this vaccine is not only safe, but it's effective and it's necessary?
Well, we need to continue to acknowledge what's happened in the past. And I've talked about Tuskegee, I've talked about Henrietta Lacks, but there are real issues going on today, right now in this country. When you look at 700 women dying of pregnancy-related complications, most of them black and brown in the United States. When you look at not just COVID, but hypertension and cancer disparities, we need to acknowledge these things, and we need to show people meaningfully, in a real sense, what we're doing to improve on these measures. And that's why, as Surgeon General, even before COVID, health equity was a critical part of everything that I did. And then we need to engage with trusted influencers. We need to make sure our pastors and imams and rabbis, all of whom I'm working with, have the facts so that they can spread it to their congregants. And we need to walk the talk. And that's why I got vaccinated on live TV. I want people to know that as a scientist, as a doctor, I've looked at the data. I know the protections that are in place. I know an African-American female helped develop this vaccine, and Tony Fauci and I made sure that the trials were enrolled with diverse participants. And I got vaccinated because I trust it, and it's how we end this pandemic.
So before you go, I want to ask you about, you had these warnings to urging people, small gatherings, forego the traditional holiday, large gatherings. And then we saw Vice President Pence on Tuesday go to Florida. I got a picture here of this rally he addressed. Packed, people, no social distancing, not a lot of masks. I mean, doesn't this hurt your effort to model good behavior and to urge people to act responsibly? I mean, why is the Vice President doing something like this?
Well, I can only speak for me, and what I consistently say is we need to understand how this virus spreads. It spreads person to person when we're close together, and especially if we're not wearing masks. So we need to do everything we can to protect ourselves from this virus because we've got vaccines. Hope is here. It's not on the way, it's here, and we're quickly getting people vaccinated. So everyone out there, get the facts about vaccines from a trusted resource so that you can get the vaccine when your time comes, because that's how we end this pandemic. But we need to remain vigilant now in all quarters. Wear a mask, wash your hands, watch your distance, wait on those gatherings so we can get as many people as possible across the finish line. That's how we beat this virus, and I feel confident that we have the tools. We just need to have the will to actually utilize those tools effectively so that everyone gets across the finish line.
Dr. Adams, thank you very much for joining us, and Happy New Year.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.